Hello, my name is Karen Zúñiga. My teacher is John Moscoso. I study in Catholic University of Guayaquil in a School of Nursing St. Vincent of Paul. I am going to talk about mutation in dual heme and serine T9 protein thyroxine kinase and dominant urinary tract malformations. Definition: congenital anomalies of the kidney and urinary tract are the most common cause of pediatric renal failure caused by a mutation in a gene known as dual heme and serine T9 protein thyroxine kinase.
Urinary tract infections, or UTIs, are fairly common, especially in women. In fact, half of all women will get a UTI at some point. UTIs occur when bacteria such as E. coli, which are usually found in your gastrointestinal tract and pelvic region, enter into your urinary system. A woman's short urethra means that bacteria don't have far to travel to infect her bladder. Typically, UTI symptoms include a burning sensation upon urination and the need to urinate frequently and urgently. Sometimes the urine can be bloody or cloudy. Symptomatic UTI usually needs a prescription antibiotic. The good news is that your doctor may be able to prescribe it over the phone if your symptoms sound like a routine UTI. But if you are experiencing fever, abdominal pain, back pain, nausea, or vomiting, or if the UTI is a possible relapse of a recently treated UTI, you will need to see your doctor. You might need to have a urine culture taken or be evaluated for a possible infection of your kidneys. To prevent UTIs, drink several glasses of fluid each day. Staying well hydrated may flush out the bacteria before they can cause an infection. It also helps if you would urinate shortly after intercourse. Finally, take frequent bathroom breaks, even when you're busy. Holding in your urine may give bacteria a chance to make themselves at home in your body. I'm Dr. Natasha. Live well.
For that.
Are congenital malformation of the kidney and urinary tract that contribute to 23% of birth defects, 1, 2, and account for 40 to 60 of pediatric cases and 7% of adult cases of end-stage renal disease (ESRD) worldwide.
Most patients with a urinary tract infection have symptoms of urinary urgency, hesitancy, pain or burning with urination, blood in the urine. However, not all patients have those symptoms. Really, there aren't great ways other than medications to prevent bladder infections. Some information in the past has suggested that cranberry juice is helpful at preventing bladder infections. Cranberries taste good, but as a method of treatment or prevention for bladder infections, it's likely to not be helpful.
St. Francis Medical Center, building on excellence.
Application: acts as a positive regulator of extracellular signal regulate kinases, phosphorylations, downstream of fibroblasts, growth factor receptor activation, may induce blood caspase-dependent apoptosis and caspase-independent cell death.
The urinary tract system includes the bladder, the kidneys, the ureters, and the urethra. Blood enters the kidneys, which are responsible for removing waste and water from the body, before urine is passed through the ureters and into the bladder, then finally the urethra. Urinary tract infections are most commonly caused by bacteria in the urinary tract system. This results in the lining of the bladder and urethra becoming irritated and inflamed. Symptoms of a UTI include a burning sensation while urinating, cloudy blood, cloudy urine, or urine that turns a dark color, and pelvic pain in women or rectal pain in men.
Pros and cons. The discovery of this genetic mutation will allow the doctors to identify people with the mutation. These disorders include a wide range of anatomical defects, such as renal agenesis, renal hypoplasia, ureteric pelvic junction obstruction, or vesiculoureteral.
A lower urinary tract infection is an infection of the urethra, the bladder, or both. The urethra is a tube that carries urine from the bladder outside the body. The bladder and the urethra are part of the urinary tract system. That is why a bladder infection is also called a lower urinary tract infection. If you have a bladder infection, you often feel a burning sensation while urinating and a pressure or painful sensation in the lower abdomen. You often feel that you have to urinate, but not much urine comes out during urination. The urine may have an unpleasant smell and may sometimes have blood in it. The most common cause of a bladder infection is a bacteria that infects the bladder mostly through the urethra. There are different factors that increase the chances of a bladder infection, which goes along with increased risk of bacterial infection. Not enough fluid intake, sexual intercourse, bad hygiene, bladder or kidney stones, pregnancy, menopause, diabetes mellitus, if you have a catheter, birth defects of urinary tract or kidneys, chemicals. Women have bladder infections more often than men because women have a shorter urethra, causing easy entry of bacteria from outside into the bladder. Even though it is often thought, it's not likely that a cold or draft can cause a bladder infection. A bladder infection is an annoying and painful complaint that in general can be treated well. The GP may prescribe antibiotics to speed up the recovery of a bladder infection and prevent complications like an infection of the ureter, kidney, pelvis, etc. To prevent bladder infections, it is important to drink 2 liters of water daily. Frequent urination washes out the bacteria. Don't resist the urge to urinate, but go to the bathroom as soon as you feel it. Always make sure to completely empty the bladder when urinating. For some women, a bladder infection recurs less frequently if they urinate after having sex.
Use applied in Ecuador. In Ecuador, the 30% found of the disease are caused by genetic mutation, and there are no genetic research centers in public hospital in national level. However, it is known that the people of the Sierra to be exposed to hyper altitudes are more likely to have genetic mutations in the body.
Hello, Valentina. I just wanted to tell you that Mrs. Hardcastle has a urinary tract infection. She started some antibiotics this morning. Oh, thanks for telling me. She didn't have any problems going to the toilet, did she? Well, older people don't always have the usual symptoms of urinary tract infections. Then how do you know that they have a bladder infection? They become confused very quickly. Not themselves, you know? Alright. I'll watch that. They may become incontinent as well. This may not be usual for them, I see. The trouble is that sometimes we just think it's normal for the elderly to be incontinent. Exactly. Just keep a close eye on all the residents, will you? If you are unsure, you can do urinalysis for blood in the urine. That's important so the infection can be treated as soon as possible. Okay, I'll do that.
Conclusion. Mutations have been detected independent DSTYK in 2.3% of patients with congenital anomalies, kidney or urinary tract, a finding that suggests that a DSTYK primary determinant of human development urinary tract downstream of FGF signaling. Thank you.